Welcome to the Danbury Surgery Residency Program. My name is Ram Seshadri and I am a transplant-trained hepatobiliary and pancreas surgeon in the Division of Surgical Oncology at Nuvance Health. I also serve as the Program Director for the Surgical Residency. We are a community-based academic medical institution and part of a larger 7-hospital healthcare system. We have a diverse group of residents from all over the country as well as the rest of the world who spend 6 years of their life training with us. Before you know, they become part of the growing family at Danbury Hospital and an integral component of the healthcare provided to the local community.
I was looking for a program that offered a lot of big academic center opportunities, but at the same time had that small town feel. And that was something that I felt that Danbury perfectly captured. You know, we have a very large simulation center. We also have the ability to do quite a bit of research here. But at the same time, you know, I know everyone's name, I know everyone's faces, and to me that was very important.
Well, the residents are exposed to our department's overall experience in terms of advanced minimally invasive surgery, and that includes a significant amount of advanced laparoscopy, robotic surgery, endovascular surgery, and thoracoscopic surgery. Danbury Hospital is now certified as a Robotic Surgery Center of Excellence. We have a robotics training curriculum that includes extensive amount of simulator time, bedside training, as well as consoles training. At the end of their certificate, they can use that to go to pretty much any hospital in the country and obtain robotic surgery privileges.
We have a very strong training paradigm in vascular surgery. We've trained many residents that went on to great fellowship in our discipline, and they've been quite happy, and we're in touch with them, and we know they're doing well.
If you need to get better at something, you can get better 24 hours a day. We have 24-hour access to part of the Sim Center and great staff that will help you out in any way that you need or any way that they can. They're very eager to help.
And we always say it's just like Vegas. Whatever happens in the sim lab stays in the sim lab. Mistakes are meant to be happening, but this is where you're honing your skills, you're making mistakes, we're guiding you, and you're getting better. And so that's the whole part of simulation. So then when you go to the operating room or you're on the floors, you're like, I'm a pro at this. Facilities that we have in the Sim Center are robust. And so we have a surgical simulation room where we have the FLS testers, we have the endoscopic simulators. We also have a robotic trainer in there, and that's available to the residents 24/7.
Nuvance Health as a whole has a commitment to education across all the different specialties, and as a member of our residency, you have opportunity to expand your horizons and grow in our research and clinical areas across the system with a focus in Danbury Hospital. We're dedicated to education here across the board and are very proud of the program we've developed in the surgery department.
The surgeons, I think, are lifelong learners, and no matter what field you're in, the practice is constantly evolving, and new technologies will be developed, new standards of care will be developed. So having the involvement in the research and sort of cultivating that mindset and dedication to lifelong learning, I think is very helpful.
Witnessing our residents actively engage in research, present their work at national conferences, and see their names in prestigious journals is a source of immense pride. Additionally, guiding them as they progress from learning basic surgical procedures to mastering complex ones and providing compassionate care during a patient's most vulnerable times reaffirms why I'm honored to be a part of the surgery residency program at Danbury Hospital.
For the past 5 years, we've seen a steady increase in our trauma volume, which directly leads to a busier SICU and acute care service. Residents rotate and spend time with us on the acute care and trauma service, gaining experience taking care of the traumatically injured and patients with common general surgical problems such as appendicitis, cholecystitis, diverticulitis, and bowel obstruction. Our goal for the acute care service is that the residents work towards supervised autonomy and running the service by the time they are a chief resident. In the operating room, all the attendings on the team believe in graduated responsibility and want to give residents the experience and opportunity to grow and learn. Residents also rotate with us in the SICU as junior residents working directly with the attendings, taking care of the sickest patients in the hospital.
Questions are actually encouraged among all levels at the residency and the attendings, but also my input is very much appreciated and valued even as an intern. They want to know what I think, and what we should do.
Danbury is a great place to train. We have a very collegial and open relationship with our trainees. We try to provide an environment in which the residents feel very comfortable.
I have no problem reaching out to anybody within each of the residency specialties. It's just been a really supportive environment that I was looking for in a program.
Since coming to Danbury Hospital, my expectations have been exceeded every day. The program is constantly evolving to keep up with the times. The demands and stress of working in a hospital are at an all-time high. To combat this, Danbury has equally grown our wellness program to prevent resident burnout before it happens.
Nearly 2/3 of our residents are now female, so I'm very proud to say that. The Women in Surgery initiative tries to foster that relationship between the female attendings and the residents. And we also try to foster that relationship between the residents at all levels.
Our residency is very diverse. Women and other minorities are well represented in our midst. We meet on a regular basis to discuss topics that are pertinent to becoming successful in our chosen disciplines.
Residency is hard. Surgery residency is difficult, but the community we have within our resident group is one of the things I do appreciate.
We're very fortunate that we have a culture here that's supportive. The residents are very well integrated with one another and have a great community. The faculty is supportive and is going to provide the training opportunities, the pathology and the injuries that you need to be a competent surgeon on graduation. And we're really looking at the residency program and the training program as a whole as the backbone and the future of our surgical department.
This is our program in a nutshell. Thank you for taking the time to learn about us, and I look forward to hearing from each of you.